If you're looking to open up some hip mobility, a good way to do that is with some TFL foam rolling. Now, if you've read any of my blogs, you know that mobility work is not the end-all be-all. It's not a fix. It is a way to open up a window to then help teach some other muscles how to do their job correctly, because tightness is a symptom, not a cause. But this TFL muscle oftentimes gets tight right through here when some of our hip stabilizers aren't working appropriately. The TFL is the muscle that attaches to the IT band, which everyone knows about, and can cause problems in runners and cyclists and those sorts of things. So I call the TFL muscle your pocket muscle, basically right where your pocket is. If this is the top of my hip, I am going to go underneath that hip into kind of where the crease of my hip is. When I come onto the side, top leg is going to come over bottom leg. So I'm actually bringing myself so I'm facing down towards the ground just a little bit. And then we're just foam rolling back and forth ever so slightly. When you find a couple hot spots, because you probably will, I just want you to do a little bit of forward and back as well too, here, and then up and down. Give that sucker a try. Try about 1 minute each side and then see if the hips feel a little bit better.